For most people, the feet are the most forgotten part of the body. They carry you faithfully through every day of your life. They cover thousands of miles across your years, and in return, you give them almost no attention, except when something goes wrong enough to demand it. For someone with diabetes, or for someone who has diabetes and does not yet know it, this neglect can have serious consequences. Because the feet are one of the places where diabetes shows itself earliest, most clearly, and most diagnostically, the signs are visible to anyone who knows what to look for, and the conditions they point to can be caught early when intervention matters most. If the person looking at their own feet knows what they are seeing, I want to walk you through 10 specific foot signs that can indicate diabetes or its complications. Today, some of them you may already know about, others may surprise you. All of them are worth knowing about, both for people who have already been diagnosed with diabetes and for people who have not been but who might be at risk. My name is Dr. Cynthia Eddy, and by the end of this conversation, you will understand your own feet better than most people ever do, and you will know what to bring to your doctor's attention if you see something that does not look right. Before I name the signs, let me explain briefly why the feet are so revealing in diabetes. Because once you understand the mechanism, everything else makes sense. When blood sugar runs high over long periods, it produces damage in two specific places that show up dramatically in the feet. The first is the small nerves throughout the body. High blood sugar damages these nerves. Sign 1. Tingling and numbness. Over time in a condition called diabetic neuropathy, the longest nerves in the body, which run all the way down to your feet and toes, are usually affected first. This is why so many of the early signs of diabetic complications appear in the feet, often before they appear anywhere else. The second is the small blood vessels. High blood sugar damages these vessels, reducing circulation to the extremities. The feet, being farthest from the heart, are particularly vulnerable to this reduced blood flow. The combination of damaged nerves and damaged blood vessels in the feet produces a specific set of changes that, taken together, are almost like a diagnostic map. A skilled clinician can examine the feet of a patient and see significant information about how well their diabetes is being controlled, how long it has been present, and what complications may be developing. What I want to give you today is the patient version of that same skill. The ability to look at your own feet with informed attention to recognize what is normal. Sign 2. Burning at night and what is not, and to know when to seek help. Are we together? Then let me walk you through the 10 signs. The first sign is numbness, tingling, or burning. Sensations in the feet or toes. This is one of the earliest and most common signs of diabetic nerve damage. It typically begins in the toes and spreads gradually upward toward the foot and lower leg over time in a pattern doctors call stocking distribution, because it follows the area that a stocking would cover. The sensation can vary from patient to patient. Some people describe persistent tingling like the pins and needles, feeling you get when your foot has fallen asleep, but lasting all the time. Others describe burning, particularly at night when they are lying still. Others describe numbness, the sense that their feet are not quite communicating with the rest of their body normally. Some describe sensations of having socks on when they are barefoot, or of walking on cotton, or of needing to feel the ground more carefully than they used to. This symptom is significant because it indicates that nerve damage has already begun. For someone who has not been diagnosed with diabetes, the appearance sign 3, wounds that won't heal of these symptoms can be the first clue that blood sugar has been elevated for some time. For someone who has been diagnosed, these symptoms indicate that the diabetes is producing complications, and that better control is urgently needed. If you have any of these sensations in your feet, please see your doctor and ask for evaluation. Blood tests can identify or confirm diabetes, and a careful examination of your feet can document the extent of any nerve involvement. Catching this early can prevent the more serious complications that follow. The second sign is the loss of sensation in the feet. This is the next stage of nerve damage, and in some ways, it is more dangerous than the tingling and burning, because it produces no symptoms that the patient notices. The nerves simply stop carrying the signals they should. The danger is that the foot can no longer feel pain, temperature, or pressure. Normally, a small cut goes unnoticed. A pebble in the shoe is not felt. A blister forms and grows. A bath that is too hot scalds the skin without the person realizing. The protective sensation that normally keeps the foot safe is gone. You can check for early loss of sensation yourself in a simple sign for skin discoloration way. Run a finger lightly across the skin of your foot and your toes with your eyes closed. You should feel the touch clearly. If the sensation is muffled, if certain areas feel less than others, or if you have trouble feeling the touch at all, this is something to bring to your doctor. The classic clinical test for sensation loss involves a thin nylon filament, called a monoelement, that is touched to specific points on the foot. If you cannot feel the filament at standard points, significant sensation loss has occurred, and your risk of foot complications is dramatically higher. Your doctor can perform this test, and any patient with diabetes or suspected diabetes should have it done as part of regular foot examinations. The third sign is foot ulcers, particularly ones that do not heal. A foot ulcer is an open wound or sore on the foot, usually on the bottom or on a pressure point. In diabetics, these can develop from minor injuries that the patient did not notice because of sensation loss, from poorly fitting shoes that rub repeatedly against an area of skin, or from other causes. What makes diabetic foot ulcers particularly serious is that they often do not heal well. The reduced circulation that comes with diabetes means that the blood flow needed for healing is impaired. The reduced nerve function means that the patient may continue to walk on the ulcer without realizing how bad it is becoming. And the elevated blood sugar sign 5. Cracked heels provides ideal conditions for bacteria to grow. A diabetic foot ulcer is one of the most serious complications in all of diabetes care. Without prompt and proper treatment, these ulcers can become infected, can spread to deeper tissues, including bone, and in the worst cases, can require amputation to control. The risk of amputation in patients with poorly controlled diabetes and chronic foot ulcers is significant, and the prevention of this outcome is one of the most important reasons for careful foot care and diabetes. If you see any open sore on your foot that has not healed within a few days, please see your doctor immediately. This is not something to wait on, and it is not something to try to manage entirely at home. Early treatment by a clinician familiar with diabetic foot care can prevent the cascade of complications that follow when ulcers are neglected. The fourth sign is changes in the color of the feet. Healthy feet have a generally pink color with skin that warms slightly when you stand, and that returns to normal color quickly if you press on it. Changes from this normal pattern can indicate problems with the circulation that diabetes affects. Feet that are pale, particularly when elevated, and that turn red or dusky sign. 6. Persistent swelling purple when lowered can indicate significant arterial disease. This pattern, called dependent rubor, is a sign that the circulation is not adequate to keep the foot well oxygenated in normal positions. Feet that have areas of bluish discoloration can indicate poor circulation or other vascular problems. Feet that have unusual dark spots that were not there before deserve attention. These can sometimes represent serious skin conditions, including melanoma, which can occur on the feet, and is sometimes missed because people do not examine their feet carefully. If you notice any significant change in the color of your feet, particularly if it is associated with other symptoms, please bring it to your doctor's attention. The fifth sign is changes in the temperature of the feet. Healthy feet should feel warm to the touch in normal room temperatures. They may feel cool after being elevated or after exposure to cold, but they should warm back up when you stand and move. Feet that are persistently cold to the touch even in warm environments, can indicate poor circulation. For diabetics, this is one of the signs that arterial disease may be developing. Conversely, an area of foot that feels warmer than the rest, or warmer than the corresponding area on the other foot can sign 7. Sharp nighttime pain indicate inflammation, infection, or a serious complication called Schko foot that can develop in diabetics with significant nerve damage. If you notice consistent temperature changes in your feet, particularly if one foot feels different from the other, please mention this to your doctor. The 6th sign is changes in the shape of the foot. This one surprises many patients because the idea that a foot can change shape sounds strange. But in patients with significant diabetic nerve damage, the structures of the foot can actually break down over time, producing changes in shape that affect how the foot bears weight and how shoes fit. Schko foot is a serious complication of diabetic neuropathy, where the bones in the foot weaken and can fracture, without the patient feeling pain. Over time, the foot can collapse and develop an abnormal shape, sometimes described as a rocker bottom, because the arch has collapsed and the bottom of the foot has become rounded. Other changes can include hammer toes, where the toes curl into abnormal positions, and bunions or other deformities that develop or worsen with diabetes-related changes. If you sign 8, cold feet, notice that your feet are changing shape, that your shoes no longer fit the way they used to, or that you are developing new bumps or deformities. Please bring this to your doctor's attention. Schko foot in particular is a medical emergency that requires prompt treatment to prevent severe deformity. The 7th sign is changes in the skin of the feet. Diabetic skin changes can take several forms. The skin can become dry and cracked, particularly on the heels, because the nerves that signal the sweat glands are not working properly, and the skin loses its normal moisture balance. Cracked, dry skin can become a portal for infection and can lead to the ulcers we discussed earlier. The skin can develop a shiny, thin, almost paper-like appearance over time, which reflects the changes in connective tissue and blood vessels that accompany long-standing diabetes. Calluses can develop more prominently and can be slower to address because of reduced healing capacity. Thick calluses in pressure areas of the foot can actually contribute to ulcer formation by transmitting pressure to deeper tissues. Specific skin conditions associated with diabetes can develop, including diabetic dermopathy, which produces brown patches on the shins and lower legs, and necrobiosis lipoidica, which produces reddish-brown patches that can develop. Sign 9. Hair loss into ulcers. Skin infections, including fungal infections between the toes, can be more common and more difficult to treat in diabetics. Persistent athlete's foot or toenail fungus that does not respond to usual treatment can be a sign that the underlying diabetes is affecting the body's ability to handle these infections. If you see significant changes in the skin of your feet, please bring them to your doctor's attention. Many of these conditions can be addressed with proper care, particularly if caught early. The 8th sign is changes in the toenails. Diabetes can affect the toenails in several ways. The nails can become thicker, more brittle, and more yellow over time, partly from the changes that diabetes produces and partly because fungal infections are more common in diabetics. Ingrown toenails can become more problematic in diabetics, both because of the increased risk of infection and because the reduced sensation means patients may not notice the problem early. Bleeding under the toenails, particularly small black spots, can sometimes occur from minor trauma that a person with normal sensation would have felt. In a diabetic with neuropathy, these injuries can happen without notice. A specific concern is that subungual melanoma, which we discussed in our nail conversation, can occur on the toenails as well as the fingernails. A new dark line on a toenail deserves the same attention as one on a fingernail. If you notice significant changes in your toenails, please bring them to your doctor's attention. Toenail problems in diabetics are not minor cosmetic concerns. They can be the start of more serious foot complications, and they deserve professional care. The ninth sign is weakness in the foot muscles or changes in walking. This is a less commonly recognized sign, but on your homework important one. The nerve damage of diabetes can affect not only the sensory nerves but also the motor nerves that control muscles. Over time, the small muscles of the foot can weaken and atrophy, producing changes in the shape of the foot and changes in how the foot functions. Patients may notice that their feet feel weaker than they used to, that they have difficulty curling their toes, that their arch has changed, or that their walking pattern has subtly shifted. They may stumble more often. They may have difficulty with balance. They may notice that their feet seem to slap the ground rather than rolling through the step normally. These changes can be subtle and can develop gradually enough that the patient adjusts without realizing what is happening. But they represent significant nerve and muscle changes that deserve attention. If you have noticed changes in how your feet feel during walking, in your balance, or in the strength of your feet, please mention this to your doctor. The 10th sign is foot infections, particularly those that develop without obvious cause or that are slow to heal. Diabetic patients are more vulnerable to foot infections than non-diabetics for the reasons we have already discussed. Elevated blood sugar provides ideal conditions for bacteria. Reduced circulation impairs healing. Reduced sensation means injuries can go unnoticed until they have become serious. Weakened immune function affects the body's ability to fight off infection. Any infection on the foot in a diabetic deserves prompt attention. This includes athlete's foot that has spread or become significant, fungal infections of the nails, bacterial infections of small cuts or wounds, and cellulitis, which is a deeper skin infection that can spread rapidly. The warning signs that an infection is becoming serious include redness that is spreading, warmth that is increasing, drainage of pus or fluid from a wound, fever, increasing pain, or visible streaking from the infection toward the rest of the foot or leg. Any of these signs requires immediate medical attention. For diabetics, foot infections are not minor problems. They can progress rapidly and can require hospitalization, intravenous antibiotics, and in severe cases, surgery or amputation. Catching them early and treating them aggressively is one of the most important parts of diabetic foot care. I want to take a moment now and talk about prevention because looking for these signs is only half the picture. The other half is doing the things that prevent them. The most important prevention is blood sugar control. The complications I have described develop primarily in patients whose diabetes has been poorly controlled over long periods. The patient who maintains good blood sugar control, who keeps their hemoglobin A1C in a reasonable range, who takes their medications as prescribed, and follows their dietary recommendations, dramatically reduces their risk of all of these foot complications. Daily foot inspection is one of the most important habits a diabetic can develop. Look at your feet every day. Use a mirror to see the bottoms if you cannot bend easily. Check between your toes. Look for any redness, any sores, any blisters, any changes from yesterday. The patient who knows what their feet look like daily can catch problems immediately when intervention is easiest. Daily washing and drying is important. Wash your feet with mild soap and water. Dry them thoroughly, particularly between the toes, because moisture in those spaces encourages fungal infection. Apply a moisturizer to keep the skin from cracking, but not between the toes where excess moisture is a problem. Proper footwear matters enormously. Diabetics should wear shoes that fit well, that protect the foot from injury, and that do not produce pressure points or rub against any area of the foot. Going barefoot is generally discouraged both indoors and outdoors because of the increased risk of injury that the patient may not feel. Toenail care should be done carefully. Cut nails straight across, not too short, not curving into the corners. If you have difficulty seeing or reaching your toenails, please have them trimmed by a professional, ideally a podiatrist who is experienced with diabetic care. Avoid heat exposure to the feet. Do not use hot water bottles, heating pads or hot baths on feet with reduced sensation, because the patient may not feel that the temperature is dangerously high. Regular professional foot examinations are essential. Every diabetic should have their feet examined by a clinician at every diabetes-focused visit, and should see a podiatrist regularly for comprehensive foot care. If this has helped you, share it with someone in your life who is managing diabetes, or who might be a parent, a spouse, a friend, the relative whose blood sugar has not been well controlled for years. The information matters most when it travels. And tell me in the comments. Tell me whether you have a diagnosis of diabetes. Tell me what foot care practices you have been doing. Tell me whether this conversation gave you something new to bring to your next medical visit. The community in those comments helps more people than you may realize. Your feet are the foundation that has carried you through your entire life. They have walked you to school as a child, run you across playgrounds, taken you to your first job, to your wedding, to the rooms where your children were born, to every place that matters to you. They are still carrying you today. For someone with diabetes, the relationship with the feet becomes more conscious. The daily attention they require is not optional. The prevention they need is one of the small acts of self-care that distinguishes the patient who avoids serious complications from the patient who does not. Take what you have heard today. Look at your feet tonight. Begin the habit of daily inspection. Get the proper footwear. Schedule the professional foot examination if you have not had one recently. Take seriously any of the signs we have discussed and bring them to your doctor. The feet you take care of today are the feet that will carry you through the years ahead. Treat them with the attention they deserve, and they will continue to carry you faithfully, the way they have done from the very beginning. Everything I have shared with you today is for educational purposes, to help you understand the foot complications of diabetes and to know what to watch for in your own care. Every patient is different, and the specifics of foot care in any individual situation depend on factors that only your own clinicians can evaluate. If you have diabetes and have not been seeing a podiatrist or a clinician who provides comprehensive foot examinations, please discuss this with your primary care doctor. Regular professional foot care is one of the most important parts of diabetes management and is associated with significantly better outcomes for people who receive it. If you notice any of the signs we discussed today, particularly open wounds, signs of infection, significant color or temperature changes, or any change that worries you, please see a clinician promptly. Foot problems in diabetics can progress rapidly, and prompt attention is one of the most important factors in preventing serious complications. If you have any difficulty examining your own feet because of vision problems, mobility limitations, or other factors, please involve a family member or caregiver in your daily foot care. The daily inspection that catches problems early is essential, and it is reasonable to ask for help with this if you need it. Thank you for spending this time with me. Thank you for being willing to take seriously a part of your body that most people forget about until something goes wrong. And thank you most of all for being the kind of person who is willing to look honestly at the feet that have carried you so far, because that informed, caring attention is one of the most important things you can offer them for the road ahead. Take care of yourself. Take care of your feet.